There's a lot of heart attack in my family. Am I doomed?
Yeah.
But there's a flip side to that question too.
Right.
And the flip side is I don't have any family history of heart disease, so I'm good, right? Yeah.
Yeah. There's a lot of confusion about genetics and how that
Uh,
relates to your cardiovascular risk. Let's try to lay it out for people. First of all, even if you have a family history of heart disease, it doesn't mean you're doomed, that's for sure. I mean, let's face it, our parents and our grandparents lived much different lives than we did, right? There was smoking, less exercise. They didn't know what we knew about cholesterol and blood pressure and sugar. So, most of your future risk is going to be dependent on the things that you do and your lifestyle and things that you can control. Yeah, Caroline, when I think of a genetic or family history of heart disease, really, I'm thinking about three different main things. Number one is for men, if you have a first degree relative with a heart attack or stroke or death less than age 55, and for women less than 65, that is potentially a genetic issue. Number two is if you have a very, very high LDL cholesterol, like at 170, 180, 190 or above, you really can't eat your way to those types of cholesterol. That's probably a genetic component, so you should be aware of that. And then thirdly, what is your lipoprotein little a? Because that is purely genetic, and 1 out of 5 of you may have an elevated LP little a level and not know about it. So just because you have one of these three things, though, you are not doomed. You just need to be more aggressive
right.
identifying your risk.
Matt, I like that. So the way that we do put that together, there's a lot of different parts to it. And when you think about the genetics, people think about one gene as identifying their risk. And really, when it comes to heart disease, it's not only one gene. It's
No,
sort of an understanding of what your family history has been
right.
and your cholesterol and the LP little a. And it's really taking that as one piece of the puzzle to
Yeah.
help fit into your risk, which a lot of it is lifestyle. A lot
Yeah.
of it comes down to lifestyle.
So if you take bad genes and
Yeah.
bad lifestyle, that amplifies your risk. If you take bad genes and very good lifestyle, you're going to minimize your risk as well.
Right.